Welcome to the Thrive Updated Medication Reconciliation Nursing Presentation. This presentation focuses on the options available to nursing for medication reconciliation. If the patient is not currently taking any home medications, no home meds may be displayed. If the patient is taking home medications, select New Home Med. Type the medication description in the name field. A list of formulary and non-formulary matches will display. Select Formulary Matches Only to remove non-formulary medications from the listing. Selecting a formulary medication when available helps to streamline the admission reconciliation process. The Formulary Matches option will stay selected for subsequent entries unless deselected. Double-click the medication to continue. Address all applicable fields on the home medication entry screen. Select Confirm if the information entered has been deemed accurate based on hospital policy. Then select Update to save the home medication. Repeat this process to document additional home medications. The Reviewed option may be selected to capture a screenshot of the home medications for the medication reconciliation history. Once all home medications have been entered, the provider may perform an admission reconciliation. Orders may be placed on the patient's pharmacy profile during this process or directly via order entry. If no active orders will be placed, select No Active Meds. Once home medications have been entered, an admission reconciliation may be performed. Nursing may perform an admission reconciliation if the behavior has been granted for the user and if reconciliation orders were received verbally or by phone from the provider. To begin, select a destination from the drop-down. The list is built-in table maintenance and is specific to each facility. If the same action will be taken for all home medications, choose Select All Home to highlight the medications. The Control key and Shift key may be used to select multiple medications without selecting all medications. Please view the updated Medication Reconciliation Sort Options Quick Cap for additional information on the available display, sort, and select options. To proceed with the reconciliation, select the medications and then select the action to be performed for admission. It is not required to address all medications for admission reconciliation. After selecting one or more medications, the following options are available. Do Not Continue Home Medication may be selected if an active medication order does not need to be placed at this time. The medication may still be selected for future reconciliations on the account. Modify Home Medication may be selected if a therapeutic alternative needs to be ordered. An alternative medication selection list will display when proceeding with the admission reconciliation. The modified medication must be selected to send to pending orders. Select Continue Home Medication if an active order needs to be placed for this medication. If the home medication was originally selected from the pharmacy formulary, the medication will automatically be sent to pending orders. If the medication was originally selected from the non-formulary medication list, the alternative medication selection list will display so that a formulary medication may be selected if available. The process of continuing non-formulary home medications may be streamlined by using the Formulary Matches table to link non-formulary medications with formulary alternatives. If the crosswalk has been created, the formulary alternative will automatically be sent to pending orders, allowing you to forego the alternative medication selection list. This functionality is also driven by behavior setup. For this example, the provider has verbally ordered that the Lasix be modified, that both the lisinopril and Zetia be discontinued. The selected actions will display in the Pending Actions column. Select Reconcile to continue. Select the order type. In this case, it is verbal. The admitting physician will display as the ordering physician, but the ordering physician may be changed if needed. Readback displays in red because it must be addressed before saving. Once complete, select Save. Because this home medication must be modified, the alternative medication selection list displays. The list may be filtered by exact matches, therapeutic alternatives, and crosswalk medications if available. The match percent is determined by the Ultimedics codes on the items. A 15-number match will result in a 100% match. A 12-number match will result in an 80% match, and a 9-number match will result in a 60% match. Medications below 60% will not list as alternate medication options. Select the medication and then select OK to proceed. Order details for the home medication display, followed by order entry options for the new medication. Dose, route, and frequency may be addressed if needed. Select Update to add the medication to pending orders. Order entry will proceed as usual from this point. Please view the order entry presentation for additional information on the order entry process. Active orders entered during admission reconciliation are automatically associated with the home medications from which they were continued or modified. Associated orders display on the same row, streamlining the reconciliation process at level of care change or discharge. Up to 3 active medications may be associated with a home medication, and there are 3 options available to associate medications that were not associated during the reconciliation process. To associate medications from the medication reconciliation screen, use the Control key on the keyboard and select a home medication along with up to 3 active medications. Then choose Associate Selected. To remove an active medication from a home medication, select the medication and then select Remove Association. To associate medications from the home medication entry screen, select the home medication and then edit Home. Select up to 3 active medications from the Associated Meds dropdowns. Then choose Update. To associate medications from the Active Medication Review screen, select the active medication and then Review Active. Choose the home medication from the Associated Med dropdown. Because these medications have already been associated, the back arrow may be selected to exit without saving.